Hi, I'm Dr. Susan Julius. I'm the Regional Medical Director of Avenues of Louisiana. Today, we're talking about controlled drug schedules and what that means. Controlled Dangerous Substance Act in 1970 classified drugs on lethality and risk for potential misuse, and they ranged them from Schedule 1 through Schedule 5. Schedule 1 is the most severely dangerous and highly lethal, and 5 is the least risk for abuse potential. Schedule 1 is like heroin, LSD, ecstasy, marijuana. Schedule 2 would be methadone, methamphetamine, cocaine, Adderall, Vyvanse, hydrocodone, oxycodone, morphine, Demerol, Dilaudid. Schedule 3 is Tylenol with codeine, buprenorphine, testosterone, ketamine. Schedule 4 are your sedatives like Xanax, Valium, Klonopin, Restorol, Halcion, Ambien. Also medicines, they're called Z drugs, Sonata and Lunesta. And then Schedule 5 is over-the-counter medications like Imodium, Parapectin, and Lamodal. One thing that I want to express and explain is that just because a drug is classified in a controlled dangerous substance or a CDS level classification, it doesn't mean that you should not take the medication or that you can't use it correctly. If you have severe anxiety or you're getting ready to prepare for a procedure, the provider may prescribe you a small dose of Valium, maybe 1 pill before your dental procedure appointment. This is very common, and if you take the medication correctly, there's no problem for abuse and potential for addiction. You just have to know what you're doing, how often you're taking it, and if you take it as prescribed and there's a limited amount prescribed, you should be fine. People with the disease of addiction, however, they need to explain to each provider that they go to that they have this illness, and if they have to be prescribed this medication, let's say they have a severe injury, a fracture, they're getting ready to go to surgery, they're going to have a major procedure where they're going to have pain afterward, they need to notify the surgeon, the anesthesiologist, and the providers that they have the illness, and not to not prescribe them the medicine, but to prescribe it carefully and to monitor it, and maybe to have someone hold the medication for the patient as they're going through recovery. So medications, when taken correctly, even if they're controlled, you shouldn't have a problem with. So thanks for joining us today to learn about controlled dangerous substances and sitting down with us. If you're having any problems with misusing a substance or have a friend or family member that you're concerned about that could have the disease of addiction, please give us a call.